Okay, as mentioned in the announcement, we'll be discussing Medicaid in Chapter 15. And again, we're talking here about Medicaid. I'll let you read the chapter objectives on your own. One of the big things that we have with Medicaid is right here, where we have issues of eligibility. What's coverage? Reimbursed? And claims instructions. So in a lot of ways, Medicaid is just like any other form of insurance. And what does Medicaid do? Medicaid provides medical and health-related services to individuals and their families with low incomes and limited resources. It is jointly funded by federal and state governments. So in other words, the money comes from the feds, goes to the states to distribute, along with some other state funds that come from the individual state governments. CMS administers and implements the laws that are related to Medicaid. And this includes things like the Children's Health Insurance Program, otherwise known as CHIP, and the Basic Health Program. There are different things that you can do with Medicaid Assistance Program. One is Medicaid, the CHIP, the Basic Healthcare Program. And for instance, in California, if you don't have health insurance and you have a medical emergency, you're taken typically to a county general hospital, such as San Francisco General, Alameda County Medical Center, otherwise known as Highland Hospital, and seen there. And if you don't have insurance, they have financial counselors that will help you apply for Medi-Cal so you can be insured and the hospital at least gets some reimbursement. Incidentally, in California, most county medical centers operate at their budget at least a 50% deficit, which is then picked up by the county and state governments. Skip over the knowledge check for right now. We kind of covered this in terms of how you're eligible for Medicaid. And again, we used to refer to these people in the 1980s as medically indigent. Basically, these are people without insurance. Also, certain special groups, people that have rare illnesses, what have you, may also be eligible for Medicaid in certain states under certain circumstances. There are other programs that impact Medicaid, and these include the Children's Health Insurance Program and PACE, programs of all-inclusive care for the elderly. And the medically needy program, basically, that blossomed a bit under the Affordable Care Act. This is provided by some state governments, and basically it expands eligibility to additional people who may have too much income to qualify for Medicaid. And then they're categorically or mandated need groups. And these are families that meet states' eligibility requirements, pregnant women and children whose family is at or below 133% of family FPL, caretakers of children under 18 or 19 if they're still in high school, people that are on SSI, and individuals or couples that live in medical institutions who have an income of up to 300% of SSI. And again, some states have eligibility for special groups, and typically you have to apply for this. And these include the qualified Medicare beneficiaries. So this would cover Medicare premiums, the deductibles, the coinsurance, copays, qualified working disabled individuals. So if somebody's disabled and working, they may get some eligibility for that and get their Part A covered, because again, as we learned, Medicare covers people that are disabled. And then other qualifying individuals, as we pick up the Part B premiums, if they meet the income eligibility requirements, and so on. So certain carve outs for these. And again, these vary from states to states. They're in terms of how you apply and other criteria. The Children's Health Insurance Program allows the state government to expand the existing insurance programs. So this was a big deal in the state of California. So additional funding going into Medi-Cal to expand the CHIP program. And again, as we talked about, the Affordable Care Act strengthened CHIP by implementing more consistent standards and systems to improve quality and lower cost. The PACE program is a little bit similar, but instead of looking after children, it looked after the elderly. And it's a bit more comprehensive and not only provides medical services, but social services. Some of your other classes, you talked about social determinants of health. This is another area for people that are isolated. Maybe they don't drive, maybe they live in rural areas and have limited access to health, and PACE helps with that. So instead of having these people go into assisted living or a SNF, it allows them to remain in the community and say receive things like home health services and so on. The spousal impoverishment program is basically enacted when a spouse is in a nursing facility, and it basically allows the community spouse who's living outside to retain a certain amount of their combined resources and income. So even if you have one spouse who's in a nursing facility, the other one will still have some access to resources and insurance and so on. And again, the eligibility and the requirements vary from state to state. Again, an important thing to take home from this lecture is that the states establish and administer their own Medicaid programs. They determine the type, amount of coverage, duration, the scope, and eligibility within the very broad parameters of CMS. So somebody who moves from California to Oregon, or especially from California or Oregon to a state in Texas, for instance, or Georgia or Alabama, will find dramatically different Medicaid coverage. The federal law does mandate certain mandatory benefits, but again, how you apply for them, how you get to them, again, will vary from state to state. And the federal law also allows states the choice of covering other services such as prescription drugs and hospice care. And again, this will vary from state to state. And that's all I have for you. Come back for the next video lecture. We'll talk more about Medicaid programs. We'll see you then. Bye now.